Great. So thanks, Hannah. We are really delighted to be here and are thrilled at the number of people that have registered and to see you all. Noise is something a lot of people don't know about, and we're here to talk about noise and its adverse health effects. And what we'd really like is to start to build awareness of noise, its health effects, and start to get some action at the professional and government levels. So my name is Jamie Banks. I am the president of a nonprofit organization called Quiet Communities. We work with communities across the country. We're a national 501c3, helping them to reduce noise and related pollution. We work in land care, aviation, hospital, healthcare facility noise, and in a bunch of other areas. There's really no particular limits, but we have 5 formalized programs. I'm here today with Sally Lusk, and she is a member of our Health Advisory Council at Quiet Communities, and also is a member of the Noise and Health Committee that I chair as well. My background is as a healthcare scientist. I worked in health outcomes, health economics, and then environment and policy. And Sally, could you introduce yourself? Sally, I think you have to unmute.
Thank you. Thank you, Jamie. And thank you all for participating today. It's a hectic time of year, and I'm so pleased so many were able to do this. I'm a professor emerita from the University of Michigan School of Nursing. While I was there, I did my research in relation to preventing noise-induced hearing loss in the work site. I also was one of the first, if not the first in the country, to measure the simultaneously in the work site workers' blood pressure and the noise exposure, finding that as the noise exposure went up, the blood pressure and heart rate went up too. So this was my passion while I was working at the School of Nursing. And since retiring, then my passion has been directed toward environmental noise. And so that's why I'm interested in sharing this information with each of you today.
And Sally, you might mention your role in the Academy's position statement as well.
Yes, as you see, as we go through, you'll see reference to a position statement and a policy brief prepared through a work group in the American Academy of Nursing and adopted and published by the American Academy of Nursing in its journal, Nursing Outlook. And it called for action, as well as we will not detail that in this presentation, but it's a lot of it is covered in what we will share in terms of the APHA paper and talk about that later. So.
Thanks, Sally. Before we get started, we'd like to acknowledge a number of people from our Noise and Health Committee at the American Public Health Association, and several of whom also participate as members of Quiet Communities. Ann Backus, Arlene Bronzaft, Kate Beaver, Janine Boda, Dan Fink, who I believe has joined us today as well, Sally that you've met, and Lucy Weinstein, who's here with us today. So here are the topics we're going to talk about. We want to go through this presentation pretty quickly because we really want to have a good, lively Q&A session and start to share ideas about how noise is affecting your life, what you see are potential solutions, actions you might be interested in, and so forth. So we'll start. Sally's going to be talking about environmental noise and its health effects. Then I'm going to take over, talk about some of the environmental justice issues associated with noise, effects on our environment and ecosystems, and then go into the history of noise regulation in the US, where we were 50 years ago versus where we are today. And then we'll talk a bit about advocacy and action before opening it up to the discussion. So Sally, you'll start with environmental noise.
Yes, thank you, Jamie. Noise has been defined as unwanted or harmful sound, and environmental noise has been defined as unwanted or harmful outdoor sound created by human or machine activity. I mentioned my passion, and I have to say here that I add to this definition the noise that may not occur outdoors, but is nonetheless harmful for individuals. And that might be inside in concert venues, movie theaters, restaurants, etc. So I'm unwilling in my efforts to limit it to outdoor sound, even though I realize I'm stepping outside the standard definition. Environmental noise has so many sources, as you can see here, and this is not exhaustive either. As you can see, with lots of sources of that outdoor noise. And you can see this clearly that it's a public health problem. It's an environmental justice problem, and it's an environmental problem. So we will talk more about all these aspects as we proceed through the presentation. Noise exposure is becoming the new secondhand smoke. This has been clearly stated in more than one place. And why is this, you say? Well, it's involuntary. The individual is exposed to noise, it's imposed on the individual, and it's out of the individual's control. And it's harmful to health. So that's how it gets this label and this bad rep. Okay, let's talk about health effects. Way back in 1968, the Surgeon General, William Stewart, called noise a nuisance. It's like calling smog an inconvenience. Noise must be considered a hazard to the health of people everywhere. Think of that, all those years ago, and we still are not attending to it. Now let's talk first about where it is more generally known, the auditory outcomes of noise exposure. It's pretty well known by most, and certainly by health professionals, that there is auditory damage, and this results in noise-induced hearing loss and tinnitus. And this is what's most commonly known. And most know also that experiencing tinnitus can be an early warning sign that one is susceptible to noise-induced hearing loss, and further exposure to noise will perhaps create that problem. And then hyperacusis, and then people often don't think of the clinical sequelae of noise-induced hearing loss in terms of falls, depression, social isolation, and dementia. There's also reduced work activity, reduced quality of life as an extreme effect, with difficulty communicating with others, with hearing instructions, hearing warning sounds, being able to and fully participate in family life. So it is a significant factor. In fact, Helen Keller said that her deafness was more of a handicap for her than her blindness. So I think that's, I was struck by that when I read that she had indicated that. And of course, we know that the hearing loss causes.
Sorry, you got muted, Sally. Can you?
I didn't touch it. I don't know how it happened.
Sorry about that.
Where did I get muted?
Just, it was only about 10 seconds.
Okay. So if I repeat reduced quality of life, that's okay. It's a severe impact on life.
Thank you.
And family relationships and so on. And of course, we know that there are costs for healthcare related to hearing loss and societal costs. Did everyone hear me say about Helen Keller? If they didn't, I want to repeat that.
Yes, we did.
You did, great, great. Okay, noise that causes sensorineural hearing loss is usually not one deafening bang, but decades worth of exposure to high decibel accessories of daily life. Leaf blowers, car horns, traffic, movie theater sounds, and so on. in relation to the environmental noise. And just to give a brief review about how this happens, sound vibrates the eardrum after entering through the outer ear and the tiny bones in the ear, which in turn vibrate the hair cells in the inner ear. These hair cells then transmit that sound to the brain for interpretation. And exposure to loud noises over time, then, it is a time factor, can permanently damage the hair cells and cause hearing loss.
So Sally, I just want to, add the point that so noise is cumulative. It really is a lifetime of exposure that can cause noise, and we know that we live in a very noisy world today. So this is really, really a concern.
Yes, it takes time usually for this to occur. There are high costs to this auditory damage. It's a common physical condition in the US. There are many, many Americans with noise-induced hearing loss. And worldwide, there are many who are exposed to unsafe levels of sound from personal audio devices and entertainment venues. Again, looking at it in not necessarily in the outdoor environment, but the personal action that can contribute to it. Nationally, there's a significant cost for hearing loss treatment. There's discussion about that being included with Medicare, which will definitely increase governmental costs to provide that service. And there's also an annual productivity loss due to hearing loss, which is also estimated in hundreds of billions per year.
Sally, I'm sorry. One thing that I want to add with regard to the worldwide figure in the middle, in younger people aged 12 to 35 years, this is a concern of the World Health Organization. The figure that they give on a worldwide basis is that 1 billion young people are at risk for hearing loss from personal audio devices, entertainment venues, and so forth. So it's a major problem.
And I would add to that there's clear data within the US that they're seeing noise-induced hearing loss in younger and younger people, primarily because of these personal devices. Okay, let's look now at the non-auditory outcomes of noise exposure. This is an area where we recognized when we prepared these papers for the Academy and in talking with people that there are many health professionals who are not aware of the non-auditory effects of noise exposure. And the general public certainly is not aware of all of these harmful effects that can occur with the noise exposure. You can see that it affects all areas of the body through this graphic, with lots of effects associated with the neurological system indicated here. And sleep quality affects the rest of the body, and the heart, hypertension, heart disease, stroke, heart attack, and also less research about low birth weight and prematurity, but it is known that metabolic effects also occur. Now, this is basically due to a stress response in the body, and we're learning more about how that operates within the body to contribute to all of these problems that are delineated here. Not going to read them all, you can see them, but you can see that they are significant in terms of impact and in terms of affecting significant numbers of the population.
Sorry, Sally, I'm just having a little clumsiness forward.
Okay, that's okay, no problem. Europe has been much more active in looking at this problem and its effects than we have seen in the United States. Unfortunately, the US is quite behind, and we will share more specifics about that as we go along. But as you can see here, they have calculated the healthy years of life lost due to noise, 1 million in traffic noise. 903,000 in terms of sleep disturbance, 61,000 in terms of heart disease, 45,000 in terms of cognitive impairment in children. And in the US, there is an estimate of 46 million Americans are at risk for hypertension due to noise exposure. And a recent US study looked at what would be the dollars saved each year by reducing noise-related hypertension and heart disease. And this was reducing the noise level by just a few decibels, would save $3.9 billion. I think there was a famous legislator who said, $1 billion here and $1 billion there, and pretty soon it's real money. Well, certainly to me, 3.9 billion a year looks like real money. So now this is a model about the stress coming to the body, and we don't expect you to tune into all of this, but it's presented just to show, give a brief overview of what's happening. It's the stress hormones, they increase blood pressure, heart rate. There are other risk factors, and then this all leads to the increased risks of stroke, heart disease, myocardial infarction, metabolic disturbances, which we mentioned in terms of the obesity, et cetera, and premature mortality. Now in this slide, it's busy, it's complex. It's not something we expect you to suddenly grab hold and retain for life. But we do want to point out what's really important. And those are the black bars on the left. It is the stress response of the body that creates all these changes. These changes lead to a vascular dysfunction. It's only been in recent years that this has actually been delineated, identified, described in terms of what's going on in the endothelium of the blood vessels. And then this leads to the diseases, the manifest diseases that are listed below. So what's important for you to know is that in more recent years, the actual occurrence of these pathologies in the body has been delineated, and as much increased understanding of what's going on. This has been called the priming effect in terms of the amplification of effects on the endothelium function of the blood vessels after prior exposure. And then this vascular sensitization, which increased oxidative stress and depletion of antioxidant defense. And Munzel is the researcher who reported and delineated this 3 years ago to increase the understanding of what was going on in the body.
Right. And Sally, I'll add to that, just to translate this to our everyday experiences. Some of us who are very interested in this topic have discussed this and said that our own personal experience is that when we're exposed to noise repeatedly, we become very sensitive to it. You know, to the point where sometimes we hear a sound that's distressing and we could almost feel our blood pressure increase. That reaction happens quite immediately. You know, it may not have happened the first time, but the second, third, fourth, repeated times, you just start feeling it happen almost immediately.
So it's a public health problem. You can see that 4 years ago, our CDC publicized their statement that continual exposure to noise can cause stress, anxiety, depression, high blood pressure, heart disease, and many other health problems. And as I said earlier, that Europe was ahead of us, and you can see that 10 years ago, the World Health Organization published their statement of excessive noise harms human health and interferes with people's daily activities at work, school, and home, leisure time, disturbs sleep, cause cardiovascular and psychophysiological effects, and reduce performance and provoke annoyance behaviors and changes in social behavior. So they have identified and listed here the significant responses to the noise exposure.
Right. And I think, all of this is to bring home that this is a major problem that we're not really addressing in any way that's at all adequate.
And everyone's vulnerable. Everyone can be affected, and will be affected by noise. But there are some particularly vulnerable groups, children and adolescents. And we know that their hearing, their inner ears may be more susceptible to noise than adults. And seniors, veterans with PTSD, TD, and the neurodevelopmental issues that affect people. So all of these are more vulnerable, but everybody is vulnerable is the take home from this. And then Jamie will discuss the environmental justice issues associated with noise.
Okay, thank you, Sally. So the burden of noise is not shared equally across the population. Like a lot of other pollutants, noise pollution has disparate impacts on low income and minority populations. This was brought out in 3 large national studies showing that low income and minority communities are exposed to more noise in general. This was actually a national map that was created that looked at this. And then a couple of other studies that looked at specifically at road and air traffic noise exposure in neighborhoods and public schools found a very consistent result. And then there's been a number of local studies. The unfortunate thing in the US is because there hasn't been funding for noise and it's really dropped off the radar screen for reasons I'll describe in just a moment. There's been very little funding for research like this, but what we have shows us very clearly, and these national studies are really major studies. What it means is that these neighborhoods are more prone to poorer health outcomes, as well as poor academic test scores. So why is this? Well, some of this has to do with the history of urban, suburban development and so forth in our country. There's a legacy from post-World War II decisions to site federal highway and aviation infrastructure near minority neighborhoods. Similarly, polluting industries have been located in lower income communities where property values are not as high, where zoning allows for this. And then, these kinds of things, I think we all know when projects come up that, wealthy, affluent communities have more voice than poorer communities. And so these things are located in those areas and not in the wealthier communities.
Just a comment here, Jamie, I was thinking about the expressways I drive and where I see the sound walls along the expressways and realizing that those are really there by the affluent subdivisions, and they're not by the other areas that I drive by.
Right, so there's a real need to address these issues, and things like sound barriers, home sound insulation, these are things that can be given to lower income communities to help reduce the impacts of noise. And this is to the point that there are many things that can be done to mediate the impact of noise. This particular article is from 1982. Arlene Bronsaft was a pioneer looking at noise and its impact on children's learning. She lives in New York and found that in schools where classrooms were close to the subway, that test scores in those children were lower than in children whose classrooms were located further away. She talked to the city government and the transit authority and got them to install pads on the rails of the subway to reduce that noise. And then they observed this reversal of the reading score disparity. So these are things that can be remedied and reversed if we would invest in them. We just want to make a last point that it's not just human health that suffers from noise, but also the larger environment. Noise, man-made noise, disrupts animal communications and habitats. It can interfere with animals' ability to find reproductive partners, to hear predators, or to find prey. This is true of land animals, it's true of marine mammals and fish, and there is quite an extensive literature in support of these findings. It also, just like humans, it affects health and vitality of wildlife populations through stress-mediated responses. There was a study a couple of years ago on noise from big computer server farms, I believe in Arizona, and they found that bluebirds nesting near these computer farms had more fragile shells, and therefore the vitality of their young was decreased versus birds that existed in quieter populations. All of this contributes to losses in biodiversity, along with a lot of other environmental stressors. Okay, we're going to change gears here now and talk about the history of noise regulation in the US. So Sally had this quote from US Surgeon General William Stewart back in 1968 that calling noise a nuisance is like calling smog an inconvenience. The sequela to that is that he went on to say in this keynote address that noise is indeed a public health hazard, a matter of public health concern. Aside from hearing loss, it's been demonstrated that noise from aircraft and other sources causes physiological changes, including cardiovascular, glandular, and respiratory effects reflective of a generalized stress reaction. It's just quite shocking that 50 plus years ago, all of this was known, and yet today in the US at least, we're not much further along. This recognition led to a number of actions starting in 1970. The Clean Air Act recognized noise as an air pollutant along with other toxic chemicals, and called for the establishment of the Office of Noise Control and Abatement within the new Environmental Protection Agency. Following that, Congress enacted the Noise Control Act of 1972. That act stated that it is the policy of the US to promote an environment for all Americans free from noise that jeopardizes their health or welfare. Makes sense given everything that we've talked about so far. It charged the Office of Noise Control and Abatement with education, research, regulations, and a number of other tasks. In 1978, as a follow-on, Congress enacted what's called the Quiet Communities Act of 1978. That called for the federal government to provide technical assistance that allowed states and communities to address noise issues at a more local level. Unfortunately, in 1981, the Office of Noise Abatement and Control was defunded by the Reagan administration. During its short tenure in the 1970s, EPA really was a leader. The US was a leader on noise. What you see here are a couple of the many publications that they put out to educate the public, to educate professionals, support regulations, and so forth. You can see noise, a health problem, and then this publication on the right, protective noise levels, is actually, the full version is many pages, and it defines safe levels of noise to protect both hearing and health. Unfortunately, those were published in 1974. There has been no update since. So we're really in an environment where there's no modern federal standards to protect the health of the public from noise. This timeline is to show those early actions starting in the late 1960s and to the time when ONAC was defunded. In the meantime, in the 40 years after that, the US basically stalled in any progress on noise and protecting the public from its adverse health effects. The World Health Organization, the European community, and a couple of our professional societies have really been carrying the ball. Just a few of the things that World Health Organization has done. In 1999, it published community noise guidelines, defining safe levels to protect noise and overall health. In 2011, it published a report called the burden of disease from environmental noise, and this is where Sally quoted some of her figures. And then in 2018, it published guidelines specific to sources of noise like road traffic, rail traffic, and aviation traffic, and interestingly lowered the thresholds significantly because of growing awareness on the health effects of noise. In terms of what we've been doing in 2017, this is through Quiet Communities. We petitioned the EPA to implement and enforce the Noise Control Act and Quiet Communities Act. Those pieces of legislation remain on the books, but are not being implemented and have not been refunded. And we'll talk about some other actions related to that petition. APHA in 2013, the American Public Health Association published an updated noise policy statement. We just got adopted yet another statement from our committee that's going to be coming out in January of 2022. And as Sally talked about, the American Academy of Nursing also put together a position paper talking about the health effects of noise and calling for action. So here we are 50 years later. Our world has gotten much noisier. We have no effective federal policy, and there's really a general lack of awareness of the public health effects of noise as well as the environmental hazards. We've also lost leadership in key industries like household appliances and aviation. In aviation, some of you might know Airbus is a European company, has really taken the lead in the aviation industry away from companies like Boeing, US companies. We also know, as Sally mentioned, that noise is exposing many people to levels that put them at risk for health consequences, over 100 million estimated to be at risk in the US. This last point is that there is common reference to noise as annoyance or nuisance. And as Dan Fink, who's on our committee and who's attending here today, this is just not an accurate definition given the serious public health consequences. But we find that federal agencies like the Federal Aviation Administration constantly refers to noise as annoyance rather than to the serious public health consequences. And this really trivializes the problem. So I'm going to turn it back to Sally, and we're going to share this to talk about what can be done about this serious problem.
Thank you, Jamie. This is a brief summary of the actions that were included in the new APHA policy statement that Jamie referenced that will be available on the APHA website in January. And part of this statement identified actions to be taken. And this is a brief listing of what was described in that policy and adopted by the American Public Health Association. What we need to do is have a well-funded, comprehensive, modern federal noise control program within the APA. We need federal noise standards, guidelines, and regulations to protect the public health from noise. This has to be done at the federal level. States and local communities are not really equipped to do this. And as Jamie mentioned, the FAA does not need to, it cannot be the only agency involved in terms of the noise because of its health effects. The reduction of noise exposures is a part of all environmental health platforms. It should be a part of all environmental health platforms. It is not. And like I said before, so many health professionals are not even aware of the negative effects of health, effects on health of the noise. I asked a new specialist I saw about his background in that, a medical doctor, and he said he'd never heard of it before. So it certainly was not in medical school curriculums in the past. I don't know if it is now. Reduction of noise exposures is critical to that. We need to address the disparate exposure to noise in low-income and minority communities. As Jamie described, there's an environmental justice issue here. And there seems to be some more interest in doing this now at the federal level. I hope that's the case. The Build Back Better, at one point, legislation had included the concept of trying to move expressways that bisected or negatively affected low-income and minority communities. So there is some potential for that, I hope. Federal agencies need to integrate noise and its impacts into its relevant activities. We've identified the need for education of the public and health professionals, the monitoring of the noise levels, setting standards about what will be acceptable noise levels for the community, and making clear the health impact and the environmental impact assessments. And at the non-federal level, other levels by state and local government, they have a role to educate, regulate, and promote programs to protect the public, and actions by the non-governmental agencies and professional societies to educate professionals and the public, and to work to influence government action to reduce harmful noise exposure. There are some organizations that are working on this. Some of them are focused primarily on hearing, and others looking a little more broadly at the other health effects.
Hold on, Sally. I'm trying to,
Okay.
I'm trying to forward it here.
Ready for you to advance.
Okay.
So as we reiterated earlier, that very brilliant Surgeon General in 1968, calling noise a nuisance, like calling smog an inconvenience. This was, as you can see, over 50 years ago. And even the Noise Control Act in 1972 said that it was the policy of the United States to promote an environment for all Americans free from noise that jeopardizes their health or welfare. So that was almost 50 years ago too. And why are we so far behind now? Is the question. And what can we do about it? So we want to talk about ways to get involved. And these are some of the ways that we could proceed, and we hope to motivate all of you to be interested in proceeding. Reviewing local ordinances. I checked in my own community, there is an ordinance, but it's not really enforced unless somebody calls up to complain. And even then, it's very spotty. Then the other activity that can be done on the local level and on the state level is to promote regulations to reduce the noise, as well as to promote their implementation and enforcement. And as we're interested in trying to do and have been working on doing, to promote legislation at state and national levels. And we also want to advocate to reduce noise and create quiet green spaces in low-income and minority communities. And as I mentioned, you don't really see the sound barriers erected for those communities either. And then Jamie will share with us what the Quiet Communities agency, or nonprofit, I should say, has been involved in to advocate with the EPA's Office of Noise Abatement and Control.
Yes, before I do that, I did want to mention to this point that Sally touched on, Build Back Better, the infrastructure bill. These are great that we're investing in this, but the construction and build out of a lot of this is going to have a particular impact on these communities of color and lower income. And so this point about advocating to reduce noise for those communities as part of the infrastructure bill is very, very important. And creating quiet green spaces that could be combined with some of these projects would be a wonderful benefit to those communities. So Sally, why don't you talk to this first, and then I'll go on.
Okay. The actions needed with health professionals and the organizations involved, I wanted to review this. Marjorie McCullough, an expert in this area, and I have written for the new second edition electronic text being published by the Alliance, a chapter on environmental noise and how it impacts health and well-being. This wonderful electronic text in its first edition had not included noise, and we're so pleased that the Alliance was willing and able to allow us to do this chapter to put emphasis on noise as an issue in the environment. And this is going to be used with nurses, and I hope other health professionals, and hope it will share this important need to take action in relation to environmental noise. And then Jamie had mentioned before the position statement, and we have the policy brief about reducing noise to improve the nation's health, developed by the American Academy of Nursing. Other organizations that are doing some activities in relation to noise, the Noise Free America has worked in terms of the landscaping equipment that is very noisy, and car horns and motorcycles and so on. Jamie, you also had information about the hearing help organization that you were going to share. So there are some organizations working with this, but having more hands, more bodies, and more heads will certainly help. And we hope that more people will become involved in trying to promote a reduction in noise.
Thanks, Sally. So I'll just mention Hearing Health Foundation is a foundation that sponsors research related to hearing health. They recently started a campaign. It's called Keep Listening, and there's a website there for those of you interested in looking into it. They have a wonderful video of people testifying how noise has affected their lives, and really how sorry they are that they were unaware of the damage it could cause and the consequences that they're bearing now. And really, it's a testimonial to the importance of education and raising awareness of this issue as a hearing health issue in this case. The campaign is targeted to a younger population, really to educate them to protect their ears, and calling attention in particular to sources, personal audio devices, and various entertainment venues. And then in terms of what we've been doing in quiet communities to address the issue of noise generally and the lack of federal legislation, I mentioned that we petitioned the EPA back in 2017. We are drawing attention again to that petition since nothing has been done. We wrote a letter in March to Secretary Buttigieg about aviation noise on behalf of many citizens, groups around the United States who are feeling distressed by aviation noise. And there are some communities, hundreds of flights going over their homes every day, and really putting them at high risk of health consequences. We've also made suggestions to the FAA's future research plans, and more recently on the EPA's strategic plan 2026. We wrote an open letter to Administrator Regan on reactivating the noise control program related to our petition, And when I say open letter, these are, I'm putting in links and I can send it to Hannah to distribute to the people attending. If you would like to sign on to those letters, you can read it and add your signature still. And then ongoing activities. Currently, we will be sending a letter to various congressional committees responsible for the EPA budget to refund the noise control program at the EPA. And then we're going to be having an upcoming conference on noise infrastructure and environmental justice, tentatively scheduled in January of next year.
So,
And yeah, I believe that's the end of the presentation, and we'd like to turn it over to Q&A and discussion. I just want to check, Sally, where are we on the time?
well, we have about 10 minutes left. We talked as quickly as we could to share a lot of information, but now we would like, and Jamie has done so much through Quiet Communities. We need to recognize that this organization has made so much progress. But now we're interested in your thoughts, ideas, strategies for reducing noise to improve health. So do they need to raise a hand or just unmute to make a comment? How should we handle this, Hannah?
Hi, thank you for that awesome presentation. I allowed people to unmute themselves. So if anyone has any questions that they'd like to ask, well, I'll let them unmute themselves and I will look through the chat box. I know we had a couple questions.
Okay, and of course, it doesn't have to be questions. It can be ideas and strategies too.
Hi, my name is Diane Pohl, and I'm in Massachusetts, and I'm really glad to be on this call. Thank you. I do have a perspective that may get the issue out in front of the public, and it's something that we have a blind spot to is noise, as we are aware, and how it relates to real estate values, house values. And there's really not a lot on it. There is a noise scale, I think, in Zillow, but it's not really, no one, in my anecdotal experience, no one except me and my husband actually are really aware of this issue. There's a website called howloud.com where you can type in an address and it gives you a noise score. But I think that similar to how climate change issues need to be incorporated into valuation of residential property, I think that noise as well should be a factor, and it needs to be out in front, and it's a consumer issue as well as a public health issue.
Great point. Yes.
Just my thoughts. Yeah.